Welcome to the Higher Power Podcast, presented by Higher Power Sports PT, the show dedicated to helping active individuals like you unlock your full potential through expert insights on injury prevention, performance enhancement, and recovery. Kurt Kessler is a board-certified specialist in sports physical therapy and an athletic trainer. In each episode, he and his guests bring you the latest evidence-based strategies to help you move better, feel stronger, and stay injury-free. Let's learn together.
Hey there, everybody. Welcome to another episode of the Higher Powered Podcast. Today, I am joined by Dr. Amy Humphrey. She is a doctor of physical therapy, board-certified orthopedic clinical specialist. She also has advanced certifications in manual therapy. She is currently a professor at Messiah University, and she is on the nominating committee for performing arts special interest groups. And she's also working towards her PhD. So I've known Dr. Humphrey throughout my PT education, and she has been one of my most helpful resources in starting my business with her experience working in the cash-based PT world. And I'm really excited to have her on today. She has a unique perspective of physical therapy from the lens of an educator and from her history of working with performing arts. She formerly worked for the Washington Ballet. And Dr. Humphrey, welcome. I'm so excited to have you on today.
Hi, happy to be here. Excited to be here.
All right, so let's start talking about your experience working with performing arts. So can you tell me, how did you get the position, or what did your typical workday look like? Just tell me a little bit about that experience.
Sure. So let me start by saying, I was a dancer. So I danced since I was 3 years old, all the way up through high school, even into college. I was actually a dance major in college. Always wanted to pursue a career in healthcare. My dad was a physician. Always thought maybe I'd be a doctor, but then once I got to college and started talking to people, realized maybe I wanted to spend a little bit more time with my patients than just a one-time visit and refer them off. And somebody introduced me to physical therapy and got interested in physical therapy. Was very lucky to get into PT school at a time that was super hard to get into PT school. It was the only choice I got, but I went and I'm glad I did. And always thought that I'd be treating dancers when I was going through physical therapy school, but got swayed by other things, loved neuro, loved working with kids, I always knew, but then was lucky enough to get an internship, or one of my final affiliation was at Body Dynamics, which still exists in Arlington, Virginia, which the clinic is famous for working with dancers. And again, 20 some years ago, they were cutting edge because not only did they specialize in working with performing artists and they had that connection with Washington Ballet, but they were also a cash-based practice. So I got a lot of different experiences there. And then, so that was my clinical affiliation. When I was done, Jen Gamboa, who by far is one of my biggest cheerleaders as well as mentors in my life, was like, hey, I don't have a job for you yet, but go work somewhere else locally, and then I'll call you when I have a job for you. And less than a year, she calls me up and says, I have a position. And so I came, and right off the bat, I was working at the Washington Ballet about 2 days a week, and then seeing patients in the clinic at Body Dynamics 3 days a week. And I was there for almost 10 years, and then moved to Lancaster, which is a whole nother journey to get me. We could talk about that too, but you asked about the dance. So that's kind of the gist. I don't know if you want me to describe what it was like to like what was a typical day. I could talk about that too.
So first of all, thanks for giving some background. I probably should have prompted a little bit more about your background, but I appreciate you sharing that because it gives perspective of why you're so passionate about it. And, you could look at a lot of us working in physical therapy, and especially the specialties that we choose are often because of the interests that we had growing up. So that's awesome. And I guess I didn't realize that, I knew you worked in the cash-based world, but I didn't realize it was quite that long ago, because the fact that you said it was cutting edge at that time, like it still feels relatively new or relatively novel now. And this was, several years ago. So yeah, I guess putting it in that perspective
I
was really,
graduated from PT school in 2002, and I started working there in 2003, so over 20 years
yeah.
ago.
Wow, that is way ahead of the curve. So that's
It
that's
is.
that's a pretty cool experience. That's a pretty cool experience. Yeah, tell me what your normal workday looked like when you were at the Washington Ballet.
Yeah, so it varied, but what we offered at the Washington Ballet, I would call it, well, I would go 2 days a week and spend about 2 to 3 hours at a time in a dedicated space that was for physical therapy. And we just had a sign up sheet that was, I don't, to be honest, I can't even remember, but it was either dancers could sign up for 20 minutes or 30 minutes of a time slot. Of course, if they needed more, I would make sure that we could figure out a schedule to get them more, but the dancers would just sign up and walk in the clinic and let us know whatever it was that they wanted us to look at, and we would treat it. We would, assess, do a quick assessment and treat. Which again, that model maybe is I don't know that I would completely equate it with an athletic training type of a model, but like it was definitely a lot more triage, I would say. And we were dealing with aches, pains, like just questionable, like, hey, this started bothering me. What should I do about it? Versus like your typical idea of what physical therapy is, where you walk in, you have a full on evaluation, you're like, I'm going to see you 6 days a week or whatever it is. I'm exaggerating there. So, 6 times in a period of time, right? And treat you. Now, if one of our dancers needed that, we would have them then come to our clinic usually to actually give them that individualized one-on-one time. Oftentimes that was also the case, like if they had to have surgery and then they really needed that, post-surgery PT, then they would come to Body Dynamics, come to the clinic. I would say that 3-hour time frame was more of a triage. And that's also the same with shows, performances. So not only was I required to show up and offer this minute clinic kind of PT, I also was asked to come backstage during performances, and I would set up schedules. And I wasn't the sole person. I had several other people at Body Dynamics that we would schedule out so that we weren't all there at the same time. The worst season is Nutcracker season, where they basically go from Thanksgiving like to like the week after Christmas, and it's like every day of the week except Monday they have like performances, sometimes two a day. Mm, We were also on call, so we would carry around, at first it was a beeper, that's how old I am, and then it was a cell phone at, these dancers. And sometimes I got calls like, hey, so and so is having an anxiety attack, what do I do? Or so and so fell, and these are the signs and symptoms, what do we do? And if I couldn't get there right away, like sometimes I'm triaging over the phone. But even the Backstage PT, very similar, a lot of triage, but oftentimes too, it's just because, not just because, but a lot of it was just overuse in the sense of sore muscles, sore joints, because they've been doing the same thing over and over and over again. So that's kind of a little bit of a life of a performing arts PT. And then I saw regular patients too, my other days of the week, which, is a different story. So
Right. So when you were working at the Washington Ballet, were you working consistently with the same performers, or was it just depending on what show was in town?
oh, that's a good point. With the Washington Ballet, it was with their performers. Now, if they had guest performers, the guest artists that would come in, they could also have access. What's interesting, and this is where you have to understand dance culture is there's a tiered system, right, within a ballet company where you have like primary dancers, and then there's sort of the secondary or the cast members, and then we have the students. A lot of these people are international too, so that's something else that you have to take into consideration. Most of them spoke English, but yet English wasn't their first language. So there was a lot of things that you had to work through to understand as well. And in that tiered system, it was sort of thought that if you were a primary dancer and you needed to see me, you would get priority, versus, the secondaries dancers and then the students, and the dancers would sort of set that up themselves. However, there are times where like I needed to really work with the students, because sometimes even they didn't have necessarily have access to healthcare, and I was really their main resource.
Yeah, I was following along with a perspective now that I wouldn't have had a year and a half or 2 years ago. So I guess it was a little bit over a year ago. The production Mamma Mia came through Hershey, and Dr. Humphrey and I were actually the two PTs that were signed up to provide care, and you had gotten sick, and I ended up picking up picking up your shift. So I got a lot of experience with that, and that was my first experience with performing arts outside of like the traditional PT clinic. And so it was a really different experience because I didn't realize, first of all, how physically demanding that profession is, the high pressure or the high stakes that they face in performing almost every single night, and just the amount of work that it takes to put into a single production. And they do this day after day, city after city. So it was pretty remarkable. And I guess the really cool thing was I got to meet a lot of different people, a lot of different types of people, a lot of different backgrounds. And it was really fun learning about them outside of their character. So that was really awesome. And
Did you
it
mostly?
was,
I know that show is, they that show required 4 days, right? Like it was there for a while.
yeah.
And did you mostly see dancers, or did you see like maybe some musicians too, cast,
Yep.
like the director,
Yeah.
maybe even
Yeah.
like even
Yep.
non necessarily performing arts, right? You saw
Yeah.
whatever.
Yeah. So, and it was cool because and I also didn't realize that they have like alternates. So not only do they need to know their lines, they need to know, you know, potentially other lines if they're filling in for somebody else, because the performers might need a night off and the next person fills in. So that was just wild to me. But yes, I treated members of the crew. I did if he was like a stage manager or whatever, but the the thing that almost made me feel bad was they are moving from city to city and relying on, people like us who just sign up. So there is like no consistency in care, and we're all doing the best that we can, but when there's not that consistency, when there's not that opportunity to see someone through, like you really are just managing their issue until they get to a break or they get to an off season or whatever. So I did feel bad for some of the folks that needed like some long term stuff, but they were just kind of piecing it together because that's their best option. So yeah, it was such a cool experience.
Yeah, no, that's
Oh,
actually key. That's very key, Kurt, that you pull up the inconsistency in care. However, they're grateful for what they do and can get on the
for sure.
road.
For sure. Yeah. And you just think like, oh, this person really needs a solid strength program for whatever this is, but you're really only there to get them through that night's show. And so you end up doing some feel good stuff or maybe just like one or two exercises to maybe help them along. But yeah, it was different, but I would love the opportunity to do that again.
Oh yeah. Well, hence my, I think maybe my title of triage, right? Like triage PT versus more just like more traditional PT, because that's how I feel like with triage PT, you're almost putting a band-aid on it just to make it go away. But obviously if somebody had like a significant issue, you would have to step in and, say, you might have to say to them, hey, you can't dance tonight or whatever it is. Although that is a lot harder to do when you're just showing up and you've met these people for the first time versus being in a company setting where I got to know all the dancers, and there were times where I had to do that. So, and I didn't mention, even though I was solely with the Washington Ballet, because Body Dynamics was known for being with the Washington Ballet, oftentimes when shows like Mamma Mia or whatever kind of shows were coming through the Kennedy Center, Warner Center, and they didn't have a physical therapist, they would call our office, and sometimes we would fill in for shows like that too. So there were many a times that I was over at any one of those theaters in downtown DC. Like, I pinch myself when I see the White House on television now, because I'm like, I used to drive by that every day.
Yeah. Yeah. That's nuts. So what prompted a change for you?
Family, honestly.
Yeah.
Family was what it did it for us. So we moved back to Lancaster, Pennsylvania, which is central Pennsylvania, and we had 5 kids. It was a lot. We were looking for a change. We were looking to be closer to my family that lived up here. And I was blessed that my husband's family was willing to follow us. And so I moved back home to be closer to family. Reluctantly, I joke that my husband brought me back kicking and screaming, because my identity was being a performing arts PT, and it was hard to leave that. And then moved to Lancaster, had a rough year or two trying to find a practice I liked. I will say I was blessed but spoiled with my cash-based practice and everything, and realized I wasn't necessarily able to have that here. Settled at a private practice locally, and just started marketing my butt off, which I had learned from Jen at Body Dynamics way back when, and just started marketing my butt off to local studios, walking in and saying, hey, can I just come in here and do a free, talk about injuries in dance? And everybody was like, sure, come on in. And that would prompt me to, send out my card. And before you knew it, I had people calling the office and specifically wanting to see me. And they were coming from all over central Pennsylvania. It wasn't just from the town that I was in. And it still wasn't enough to have a full-time job in a private practice, but it kept my, heart full with my performing artists. So yeah, that's really what led me up here. And then I would also say then the change to going into academia was also quite natural, because again, when I was at Body Dynamics, from day one, the minute I walked in that door, Jen said, it's time to give back, and the best way to give back is to mentor the next generation of PTs. So a year out of school, I had students, and I was a clinical instructor, and probably, had a student almost every year. I was at Body Dynamics, and then when I came up here, and I taught as an adjunct at George Washington University too, part of that time, which also kind of got me involved in teaching. And so when I moved up here, I still was a CI, and most of my students, because again, they knew me, came to me because they wanted some sort of dance, specialty. I just always knew I loved teaching. And when Messiah came up as a possible job opportunity, I just went for it, not even thinking I'd be blessed to have a job, and got a job here. And that was 7 years ago, and I've loved that transition. Still stay in practice, mostly with my dancers, although not all my patients are dancers. They're past patients that I've had too, but I still do see patients as needed, but it's not my primary focus, although I still love that, and I still bring that. Being able to say that I can work with these people allows me to bring a lot of conversations with my students into the classroom. So that connection has been great.
Well, I am just one of many that you have been able to help along the way, and I'll speak for everybody else. We're thankful for the opportunity we've had to work with you. Let's talk about some different aspects of performing arts and how this population is unique. So, as people know, I have my specialty in sports physical therapy, but performing arts is more of like a subspecialty from sports and orthopedics. So, this is like you get into the niche areas like yourself. What are some areas of performing arts that a sports PT or an orthopedic PT needs to be familiar with?
Sure. Well, you mentioned from your experience with Mamma Mia just the demands, right, of the activity. And some of that is very similar to sports in that there's usually training schedules, games, right, which we can interlay performances with games. So there is a high intensity period of time versus probably a lower, training period of time. Sometimes there's even time off. It depends again on the situation that you're in. Like something like Mamma Mia, where you're traveling, right? Like, imagine that you do two performances every day for 5 days straight. And then on Sunday night, you pack up a truck, you get on a bus, and you're sleeping on said bus and driving to the next town that could be 13 to 24 hours away, right? Like, there's that. And again, there's probably similarities with sports teams moving college teams, right? But then there's recreational dancers. I mean, those that are starting. Oftentimes, dance usually runs from like September, and then there's shows or performances in May or June, and then they have the summers off, right? Like, so, but they might choose to go to dance intensives or week long events, that is a quick, short amount of time of training, but high intensity within that time frame. And then they have several days to weeks off. So you just have to understand, and this all comes back to like talking to your patient or talking to your client and understanding what kind of training routine they have and the demands that are asked of them. Like, one of the first questions I ask my dancers are, when's your next performance, or when's your next competition, right? Like, are you here and like tomorrow you're going to be off performing, or do I have a week and a half before you're off performing, right? um Besides that, I would also, that there's one slight big difference I would say with sports is, besides the physicality, there is the emotional and expressive part of dance that I don't feel like you have to have in a sport, right? Like, you're not required to be an actress in a way, or an actor. Yeah, that I think is also, that expressive piece of things is very different in performing artists. Otherwise, you're right. There is a high incidence of hypermobility, specifically in dancers, because we could also sit down and talk about the different, and maybe we should, like, the categories of performing artists, right? Which dance falls in that, but you've got gymnastics, which could also be known for hypermobility, skaters, like your figure skaters as well, but then aerial performance, like Cirque du Soleil performance people, musicians as well. So there's a lot in that to unpack between all those different types of performing artists. Um, so there, hypermobility, I would say, is one aspect of things that I feel like performing artists want their clinicians to understand, because when they tell you that they have to kick their leg and almost touch their nose, like, they don't want to be scoffed at, that they shouldn't be able to do that, or that's abnormal for them to do that. And so you need to understand what is required of them and hope that you can get them as closely back to doing that as possible. I did have a Washington ballet dancer once who tore his calf muscle, and had to have surgery to, fix the torn muscle. And you can only imagine just the devastation of all that. But aesthetics was super important to him. I mean, he successfully returned, but it took him a long time. The focus on he was so concerned about his one calf looking so different than his other calf muscle. And so aesthetics is very important. How one looks or how one is supposed to look, especially in dance, is very important sometimes to these dancers.
You hit on so many good things, and I'm almost just like a fan sitting here listening to you talk about this, because it validates the whole reason why I bring guests like you on that have such depth of knowledge in certain areas. So a couple things stood out to me. One, I used to especially when I was a younger clinician, I'm still relatively young in the field, but when I was a younger clinician, I used to get overwhelmed with like having to know every type of movement or every this or that. But when you boil it down, like they have higher intensity periods, they have lower intensity periods, and just relating that to, I mean, my language is athlete, so relating that there was made perfect sense. Perfect sense. And then the other thing is just, we're talking about the subspecialty of performing arts, and you're bringing up the subspecialty of all these different aspects, which all come with their different demands, all come with their different seasons. And it's, gosh, I could just spend all day talking about this. So I really appreciate that perspective. I do want to dive a little bit deeper into the hypermobility, because I do feel like that is a big theme with especially dancers, or at least the ones that I've seen. Now, you had mentioned, some of them may need to be able to reach their knee to their nose or something similar to that. And I've seen several cases of one, like you talked about, a clinician basically saying you don't need to get that far, that's too much motion. And you can imagine if you're on the other end of that, like, no, this is exactly what I need to be able to do. And if you have a provider telling you that's not what you should be doing, it's just a clear disconnect. And you could see how that would not be a super effective pairing. But I've also seen on the other side where, you have these dancers that can bring their knee to their nose and they complain of feeling tight. And so then the therapist will just say, oh, you feel tight? Well, let me just stretch you, which is also not the right consideration there. So can you tell those who are listening just some general themes or general thoughts that you have for these hypermobile types of athletes?
Sure. Yeah. So again, this also goes a little bit back to culture. And then when you talk about subspecialties, Kurt, which I know I just blew your mind, there's also subspecialties in dance, right? Because ballet is the most researched. And I told you I'm part of Washington Ballet, but there's modern, there's tap, there's hip hop, there's Irish dance. And every single one of those dance techniques also has like their special injuries and training schedules, right? So, but again, my major experience goes back to Washington Ballet. And I also didn't mention I was at the Washington Ballet, but we were also at Kiroff Academy, which is a boarding school for students in the US, but also international, that starts in middle school and high school, where these kids come and live there, and then their life is dance, and they're what's called Russian or Vaganova trained. So I bring this up because that's also a very different population. When I bring up culture, the culture in and I believe that this is changing, I truly do, but like warm up to these dancers was sitting outside the classroom waiting for the class before them to end, and they'd all be in like splits with nose to the floor, just laying there stretching out without any true warm up, right? And so why do I bring that up? Because flexibility was important to them. Half of our job, I believe, is education. And so it was a lot to educate students instructors, right? Other healthcare professionals to understand the importance that how does our body work and how do you gain increased motion or how do you maintain increased motion? And so, doing things like active stretching versus passive stretching. And, I would never tell a dancer that you should never do passive stretching. Well, I guess I should never say never, but like as a way to warm up, I think my point is just that like I think passive stretching has its place, but like understanding the difference and what does that mean to a dancer and what can I give a dancer, right, to make them feel like they are warming up their body, but they're also working at the ranges that their joints provide them, understanding that they have to get to those end ranges. And sometimes they live there a lot of the time. And then that goes back to injury is just, I do think it's important. And I think, I just talked about this when I taught the students in the TheraX class about special populations. But generally speaking, right, you have to put your patient first. What are their goals? So if their goal is to get their leg to their nose, then you have to sit back and say, is that realistic? And take out your biases. Maybe go to the research, right? Like look up what's there and truly try to understand if you can help this person get there. And again, I it would be hard for me to say, I don't think you're ever going to go there. Now, if that person had some sort of, I have a patient right now who's not a dancer, but is 32 years old and just had a total knee replacement. He was, a Marine and several injuries of his knee in high school. And now he has a total knee replacement. And he wants to have his full he's a strength and conditioning coach. He trains my kids. So he wants to have as full of range of motion in his knee as possible. But, he has flat out said to me, he's like, the doctor told me that I might not have it as exactly the same as the other. And so there might be limitations, but you bet we're going to try and get him as much as he can possibly can, and work towards that. So yeah, I think I answered your question there, but hopefully I answered it there. But yeah, in hypermobility, I think the big gist I would just tell you is I always start from neutral because oftentimes we forget about neutral. Teach them how to stabilize in neutral, strengthen them in neutral if that's the case. But I do this even with my non-performing artists, but if whatever range it is that they have, I have to strengthen them in that range, even if it means I have to get them to that end range. I'm not starting there. That's why I started neutral. But I will, I do find that some PTs don't take that time to get them to the end range. They know where to start and they get them on the path, and sometimes they don't finish. And oftentimes that's when they show up in my office, to be honest, is at the end.
Yeah. There's a lot there that I can relate to. I think the most powerful thing you said was strengthening through that range of motion. So one of the common things, like I said, you'll hear them say, oh, I just feel tight. I feel like I need to be stretched. And so that's what they do. They just hang out at those extreme end ranges of motion. And what their body is really asking for is some stability around that, because they're almost trying to, you get to that end range, and when you don't have the control, you don't have the strength or stability throughout that full range, then the muscles start to get a little bit unhappy, and then they start squeezing up just a little bit, and it gives that sensation of tightness or sensation of needing to stretch, when really it's stability is what they're needing. So I appreciate you giving your perspective of starting at neutral so that their body can find what that position is, and then from there progressing to stabilizing through those extreme ranges. And if I had to take this from almost like a dancer's perspective into a more like team sport perspective, I'm thinking like pitchers who have that extreme range of motion and external rotation as they're cocking back to throw the ball. And if they don't have the control in that, then they're going to either try to find it from the elbow or the wrist or somewhere else in their body. And then you kind of get stuff breaking down along the way. So see that very similar to performing arts and dancers more specifically, because they do tend to hang out in those extreme ranges. And if it's not stable, if it's not well controlled, then the body can start producing some of these sensations that they feel they just need to stretch it out.
And I would say that you can relate in many ways. A baseball player, that's a great example, that external rotation versus the internal, to again, dancers that use turnout, which is extreme external rotation. And that's a lot what I talk about, because all dancers want to know, how can I improve my turnout? That's what you might hear. Me, again, going back to education, explaining to them that 60% of your turnout comes from your hip, which not many of them even realize that, because they're just so focused on turning out their feet. And so the 40% of turnout actually comes from your knee and ankle. And so you are correct. If they're not utilizing the hip, where is it going to go to? Knee and ankle. And this might segue into one of your questions, what are the top most common injuries in dance? Well, number one is foot and ankle. Number two is knee.
Yeah.
And that's a lot of times it's because of the demands, but it's also because if they're not utilizing their turnout the way that they should, that's where the stress goes, the load goes.
So in those cases, what are some things that you're working on? What are some ways that you're focusing on the hip? Talk us through some of that, because yes, if they're getting extra motion from the knee or the ankle, or, stressing those tissues beyond the demand that they can withstand, then you're going to get some breakdown. So kind of shifting that stress up towards the hip. Tell me just kind of what your thought process is in treating something like that.
Sure. I mean, I mean, you can look at this a lot of different ways. One way to look at it is you can look at it from the bottom going up, but you can also look at it from the top going down, and top meaning more hip. We can get into spine later. First, I'm going to measure range of motion, right? What's normal external rotation? So 45 degrees is for the average individual, but for dancers, this is again going back to our discussion about increased range of motion. They need more like 60 degrees, or somewhere between 45 and 60 degrees. But again, when you watch a dancer turn out, their ideal is to get that 180 degrees. Well, again, the rest is coming from knee and ankle. So I need to see what they have at the hip, and then I look at how they utilize that. So if somebody has decent range of motion of their external rotation, I will often take the floor, which is friction, right, out of the equation. I have discs, like moving discs, that I stick my dancers on, and I have them go in what's called parallel, which is most common, toes facing forward, and have them turn out. And I can measure that as well. And so what I'm looking at is, does their active and passive range of motion match, right? And then what's it in open chain, and then what's it in closed chain, because they have to utilize both in open chain and closed chain. So just looking at that at the hip is part one. And then going down to the feet, I would say, dorsiflexion. Obviously, there's a lot of research out there that says that, knee and hip issues can often also be part of lack of dorsiflexion, which again, dancers are required to be a lot in plantar flexion.
Yeah.
So it would, you have the assumption that they might have tight calf muscles or a tight, talocrural joint, right? And so you need to look at that and then assess it, treat it if it's an issue, whether it's muscular, joint, or both, so that they don't get that excessive pronation, which then again, between the hip and the ankle, can then cause problems at the knee.
Yeah.
That's simplified, but hopefully that helps you.
That's and that's such a good point, because yes, there is so much emphasis on plantar flexion, or going up on the tippy toes, that especially if you are doing a type of dance where you need to leave the floor and land, like the dorsiflexion, the ability to absorb that impact is so crucial. So that's just such a great point, and it gives me and hopefully the listener even more appreciation for like the demands that these athletes need to stand up to in order to just perform and then perform at their best. So that's just really good stuff.
And then to just add the extra layer, we didn't even talk about shoes. We didn't even talk about flooring.
I know.
And we didn't talk about costumes or anything, that are all added elements, right?
Yeah. Yeah. Gosh, so what I'm learning is that we could have like the first ever 24-hour podcast where
we could.
We talk about all things performing arts.
I know. It's great.
What message or what advice do you have for clinicians or people wanting to treat or work in performing arts?
Yeah, so there's a load of ways to get education. I mean, one is research. I mean, going out there and actually researching diagnoses or researching information. There's not a ton, but there's a lot. And there's going back to all the different types of performing artists. There's more definitely research, I think I mentioned, in ballet than in other types, but it's out there. It's coming. I would also state that the orthopedic section has a subset called the Performing Arts Special Interest Group, which I'm on nominating committee for. To get information from PASIG, you need to be an APTA member and then an orthopedic member, but the PASIG is free. Once you're an orthopedic member, they have a boatload of information that you can, there's monographs, just like for your OCS monograph, there's monographs on performing artists. There was just recently one on aerialists. There used to be one for dance in general. There's just a lot. So that is a great resource. They also provide some podcasts through orthopedic section too. PASIC does on different people who are working with dancers that you can look up. However, Harkness Center for Dance has education centers. I think Boston University has Heather Southwick is somebody up there that they have. There's a lot of people out there that you can get training. Otherwise, I would say just I would say if you can find somebody like me, which I'm always happy to talk to people, anybody can reach out to me at any time and ask me questions, and I'd be happy to meet with them. There's a lot of us that are out there that realize that you just need to connect with someone and get involved and ask questions sometimes, and that's really one way to educate yourself on dancers as well. So there's also a fellowship out there. There's 2 or 3. One's at Johns Hopkins, I believe. One's out at Azusa Pacific University in California. They're slowly coming out where you could get a fellowship. Of course, you have to have an OCS first. You have to go through residency and then move on to fellowship from there if you really want to get trained by somebody that works with performing artists. Although I didn't do that, I would say mine was on the job training. So if you can just get connected to somebody, and there's a lot more of us now than there used to be, you could just start by observing. Ask if you can come in and observe what they do for a day, make your connection, and hopefully you can find somebody that you feel comfortable with and start, talking about patients, clients, and whoever, and build a relationship.
Last question, message or advice for those performers looking for the highest level of care? How can they find people like you? How can they find the top level of care or someone who really understands what they need?
Yeah, that's also a great question. You can use APTA's Find a PT search engine, which you would just type in APTA Find a PT, and you would type in performing arts. You could type in dance, musician. You could get a little bit more specific. If not, performing arts is probably the buzzword or trendy word to use. Same thing if you just go and use Google out there. The PASIG has their own Facebook page, although I think it's closed to members, but we are constantly if there's touring shows and they're showing up in Lancaster, Pennsylvania, I always see, hey, I have a dancer who's gone from Houston to Lancaster, who's in Lancaster that's a performing art, so we network very well in performing arts PTs. So if you can't find somebody on the internet, I would say reach out to a physical therapist, maybe that you feel comfortable with, and see if they can use their inner working network system to find a performing arts PT for you.
Yeah, I think it's so it's so important for people to find the right provider. And one of the challenges that I'm noticing in this space is people just don't know there are more than one option. People will just take their script from their doctor and go to whatever, big clinic is closest. So that's always a question I'm finishing with my guests is how can patients find the right provider? So I appreciate your help in reaching out there. Okay, that's all we have for today. We could probably, like I said, go for about 23 more hours, but we'll save some juice for another podcast.
That sounds awesome. That would be exciting.
Thank you so much.
Thank you.
I just want to take a second and let you know how much I appreciate you, not only for the help that you provide me, but for coming on here and sharing your knowledge. I'm so blessed with great resources around me, and that's part of my mission here is just to highlight some of the great clinicians that I've gotten to know and gotten to work with, and just let others know what we as a profession have to offer. So thank you so much for your time. Thank you for coming on here, and we're definitely going to do this again in the future.
Thank you, Kurt. We're so proud of you. So thank you. Awesome.
That's going to do it for today's episode of the Higher Powered Podcast. Thank you for everybody for listening. If you would like to connect with me, you can find ways to connect in the show notes or find me on Instagram at Higher Power Sports PT. And we'll see you next time.
That's a wrap for today's episode of the Higher Powered Podcast, presented by Higher Powered Sports PT. We hope you gained valuable insights on how to stay strong, move better, and prevent injury, all backed by expert knowledge in sports physical therapy and athletic training. If you enjoyed today's episode, don't forget to subscribe, rate, and review. Your support helps us bring more evidence-based tips and strategies to active individuals just like you. For more resources or to connect with us, head over to hpsportspt.com. That's hpsportspt.com. Remember, you've got the power to perform at your best. Keep training smarter, recovering faster, and living stronger. Just a reminder that the content shared in this podcast is for informational and entertainment purposes only. It should not be considered medical advice. Always consult with a qualified healthcare professional before making any changes to your health or treatment plan. Thanks for tuning in. We hope to see you next time on the Higher Powered Podcast.